Welcome. I'm Mike Kulwiec. I'm your host. This is Dental Insight. Today, I am delighted to welcome Dr. James Klim. James, it's so good to see you. I'm so happy that you're with me today and giving us an opportunity to learn more about your accomplishments and your
Mm.
perspectives on dentistry today. So thank you. Welcome to Dental Insight.
Mike, I love hanging out with you. We've been hanging together for probably 38 years.
Yeah, it's been a long time. And I think we've aged fairly well. Um,
You're looking good. I
Likewise.
do I do color my hair and
Uh,
beard.
well, good for you.
I thought transparency is part of your podcast, so I might as well kind of
Well, I
move right
I
into
haven't
that.
added any color yet, but so be it. Let's get down to brass tacks. I want our audience to know uh, more about you and your background. So let me share with those with us today what Dr. James Klim has been up to through the course of his career. So Dr. Klim is recognized as an international educator in biofunctional, pay close attention now, biofunctional and aesthetic CAD-CAM dentistry. Biofunctional and aesthetic CAD-CAM dentistry. That alone is, okay, that's got everybody interested. You're known for your expertise as a speaker, author, and educator. You were recently appointed as a research and content development consultant for Ivoclar, incredible company, great history, great products, great technology. You're a highly decorated academic. You're a fellow in the Academy of General Dentistry and an accredited member of the American Academy of Cosmetic Dentistry, where you just recently spoke.
Mhm.
And I know you've been there a good number of times as a speaker. In addition to practicing in both California and Idaho, and you're in Idaho today, you were the founder of the Klim Institute. And at that institute, you direct the online training programs while also, last but not least, hosting a podcast called We Talk Dentistry. So, James, you clearly are not leaving any dust around your feet. You're stirring up the dust. What a wonderful career you've had to this point. There's a lot more for you to contribute. You've done so many things. Let me get into, I think, a question that's really important to any dentist today. And given the depth of your background, what do you see as the three most important subjects that a dentist should master in dentistry today, young or old?
Good. Keep me coming back on that because I'm gonna kind of be transparent with myself and go back through my 4 decades of dentistry. I'm now in my fifth. Can you believe that, Michael? And I still practice. I'm involved with education, so my perspective have matured through the years.
Okay.
And when I look back, what are the top three things for me? I'm going to translate it that way because I do coach a lot of dentists in many different ways. In fact, every class I teach, I always come back to the why of why I'm here. So that's number one. Why am I here? We're doing dentistry. Dentistry is a very complete skill set, right? Leadership, clinical development, communication, interaction with patients. It's a big slate to fill. I didn't know that in dental school. I had a dream, which is probably pretty good at the time because if you know everything I know now, and I knew that in dental school, that would be a tough career to choose. But yet it's been one of the best careers for me because I learned my why. And what I mean by that is I found out within dentistry what really inspires me. In fact, Mike, I learned some of that at some of the courses you provided at your lab. Do you remember Dr. James Hastings? And you brought in Hornbrook as well.
Exactly. Yeah.
Those are quite a few years ago. But I found that attraction within dentistry. First of all, I love people. Second of all, I like control. Maybe that's why I chose dentistry. So if you bring that into the package, through the years, I developed an appreciation for a lot of things that your lab did. In fact, I used your lab earlier in my career, and then I became I became a master of ceramics and dentistry in that aspect. So in my practice today, I fulfill everything. Through digital dentistry, is I do all my ceramics, my zirconia, you name it. And I teach that. And I really enjoy that a lot. But that was my why. And that's why I'm bringing that up. And what I found out, in fact, this happened a few years ago where my wife and I lost a child. And
I'm so sorry.
the hiccups of life define you.
Yeah.
And you can't always control them. In fact, a lot of times you can't. And you have to take those hiccups and learn from them. So during that process, what I found out is that my wife and I wanted to keep our marriage vital. Quite often, when you go through pain and heartache, your core fears come up, which we could talk about that because it really involves dentistry. And then you divide. So we decided to get involved with learning about ourselves and how we go through grief processing and all that. And during that time, we took this brain test. And I know you're going to ask me which one it is. It will come. It's back here somewhere. But we found out what our strengths were within the brain and what the philosophy and the literature behind this brain test is that when you activate the corner of your brain that's genetically inclined to be your best corner, such as, for instance, we have 4 quadrants, right? They find that quadrant, there's a quadrant in everybody that's more oxygenated than others, right? So I found out mine was my upper right, which is creativity, artistry. Lower right is connection. So to be a good dentist, if you're placing an implant or doing brain surgery, you have to go down to your lower left, which is the detail sequence aspect of it. But to do that, it takes a lot more energy. So what I found out is, first of all, I don't like a really fast-paced practice where I'm running from chair to chair. So I developed skill sets. Like last week, I had one patient the whole week where I reconstructed their whole mouth using the skill sets I have, so I can stay in my present brain strength. And that really made a difference in the choices I made. So what I found out within my why is, so I want a work-life balance so I can interchain my brain strength in my clinical theater so I can enjoy my career to the most. And they find that when you do that, it will do other things for your body, such as optimize your immune system, optimize your hormones, oxytocin, serotonin, all the hormones that we need for connection. When we're in that upper right brain, you'll keep those more present, which means you take that home at night to your family. See, you see where I'm
James,
going with this?
let me interrupt you. What I
Yeah.
just My interpretation of what you just said
Hmm.
is that we're all unique.
Yes.
And I ask you this question: you consider to be the 3 most
Hmm.
skills to master? And
Yes.
your point is, well, they generally speaking, these may be the 3 most important skills, is I think what you may wind up telling me. But what I also hear you saying is you can't be prescriptive and say that for everybody,
No, you can't.
this is going to be what you should excel at. And having said that, and which I so much appreciate, which is what you're saying, right? Is you've got to
Yeah.
find where your brain is the most oxygenated, where you're getting your joy, and incorporate that
Joy.
into dentistry, which means that okay, you still are using a drill, you're still going to take impressions, or somebody's going to take impressions, you're still going to talk to people. So let's go again to that ground zero, whether it's a young dentist right out of dental school, middle age, or the guy's got another 10 years left. When you think about mastery, what are the core things that you see as essential to success in dentistry?
Okay, I want to make my point here because I'm going to still go back to your why.
Okay.
If you don't find your why in what you're doing in life, whether it be dentistry or not, you don't have a template to make good choices, right? So all my continuing education has come through my why and why
Yeah.
I'm there. And that, I think that's the point. You may have felt like I was going off script, but I'm really not, because I coach, I don't even know how many dentists I've coached through the years. But even in my clinical classes, we always touch on what is your why, because it makes a difference on the choices you make. So that's my number one aspect. Once you find your why, my number two aspect on that would be educate, educate, educate. Develop yourself so you become
Yeah,
exceptional at what you do. Now let's talk about that. What do we mean by work-life balance? And I'm going to tie in a little bit of another story here because it had a huge impact on me. My dad, when I was a kid, we didn't have a lot of money, but my dad had really good coaching abilities. And my brother and I started this business cleaning churches. And that's back when I was 10 years old. And we learned responsibility, perseverance, and determination. So let's bring that back to the present, right? Within dentistry, when you know your why and you find your joy factor within your profession, then you educate yourself to become the master of that perfection within your dentistry. That's your field of dreams, right?
got
So
it.
if you find your why, you got to get your field of dreams. You know, there was a study done a few years ago, and they asked professionals like us, dentists and physicians, on where do you think you are in the tier of your profession, and almost everyone said top 10%, right? Well, that's good. I don't want to go to someone who's in the bottom 10%, but that's a good place to be. But what does it really take to be in the top 10%? You need natural abilities, but more important than that, you need determination, perseverance, and focus and develop yourself. Even now, as an educator and doing this for over 40 years, I still do a ton of CE. Why? I like to learn. Sure, I teach, but to teach, to really be a good educator, you have to be a learner. And so I can't overemphasize that because so many doctors go in and they'll tell me, well, we can't do that because of this, or I can't do that because of that. I would say that is a roadblock and a bias that is going to hold people back. So getting back to where I started, find your why. Your why should identify your field of dreams. Once you identify your field of dreams, then you take the steps through mentorship, through education, develop yourself to be exceptional at your why, particularly in the dental office, right? And then if I were to add a third spoke to that, as far as my success has been, it's about connecting with people, right?
Yeah,
And the way you learn how to connect is to, it's easy to connect when things are really pleasant, but how do you connect so people can trust you? And,
yeah,
and we're looking eyeball to eyeball right now, but you're doing more than that. You're looking into my heart. So the question, am I real? Am I holding things back? That goes back to my number one is when you find your why, you'll be more real in your heart. And when you're more real in your heart, you connect in a way where people find out who you really are. I can tell you right now, number one thing for business success today is be trustable.
absolutely. And
So
that's
how do people determine it? You know, and I can tell you, my wife can walk into a room and know whether someone is trustable within 2 seconds.
yeah. So
And we
she's
could
a
even,
great judge of the
yeah,
vibe and the character of a person
exactly.
from her
So what's the
experience as a human being.
intuitive feel?
Yeah,
Then once you have that ability to do that, then your team around you
yeah,
develops in that same order. So part of that being a true connection is be able to connect with yourself so you can get around your biases. We all have biases. I have biases.
right.
But people that know me in the profession will know that I'll change. I'll change with education. And part of that is humility. Be humble here. We still need an ego. I need an ego here just to go to work, right?
Yeah,
But I also need humility so I can listen to what is around me, both in the conscious communication for my team, my patients, my wife, other people in the profession, and then what comes to you in your subconscious assessment of yourself. Being able to listen to your subconscious is part of connecting with people. I think I really love my dentistry, Michael, but I think I like connecting with people more than anything else at this stage of my career. Because
isn't that interesting? And
you,
James, I will share this. Number one, I love what you just said. It's so true and so real, and I agree with it. After my 45 years in dentistry,
Hmm.
and in business, you've got to know your why. You have to understand
Hmm.
what did this creator design you to do. Some people
That's
are meant
right.
to are meant to work with numbers all day long. Some people are meant to build things. Some people are meant to talk to people. Some people are meant to do both. And I think the sooner you understand that, as if you have chosen the career, the profession of dentistry, just understand that no two dentists are identical. You have
Nope.
to really get a feel for what it is that brings you joy and what's easy for you to do and what's more difficult for you to do. So if you
Hmm.
decide, I don't ever want to do endo as a general dentist, fine. Then
That's right.
then you do that. Now, your other point is about education, and that's this
Hmm.
this is this self-determination to be the best you can be,
Hmm.
the best you can be, not relative to the James Klims of the world who
Nope.
are NBA caliber guys, but you can learn from the James Klims of the world. You can emulate them, and moreover, you can take the nuggets,
That's right.
the fruit from their tree, and you don't have to worry about planting it and tending into it. He's done all that for you, which is amazing, and we'll spend more time on that subject today.
Hmm.
But last but not least, I love your point about connection. And
Hmm.
I will tell you, just as a balance to what you said, I've been in over 1,000 dental practices in my career. The one,
That's a lot.
it's a lot. The one,
Yeah.
the most successful were not the fanciest or the most worn out. They were the ones that had the best connection
Yeah.
with each other and with the patient. And
Hmm.
would you not agree that in what you've seen in your own practice and what you know of other practices, that last element that you talked about, connection, boy, that's kind of the fundamental to it all.
You've got it, Mike. What I see now, and people get worried about a competition, I never have in my town. In fact, I get a lot of referrals from other dentists, and I'll call them up and say, "You can do this case. I'll come over and help you do it when it's the right thing." So when I say about connection, it's about giving back, but connection is about helping people feel safe in your presence. Like for instance, I love my new patient exam. I never see patients new out of the hygiene. They're always in my schedule and we connect. We go eyeball to eyeball and we find out whether we're a match. And that's fun to do. You find out what interests them, have curiosity in other people. People want to always ask me, well, how do you treatment plan and sell cases? Well, I have a philosophy that I go on. I do listen to patients though, but my why is highly ingrained within my philosophy. So what my goal is to allow a patient to feel safe to interview me as I interview them to see if we're a match, just like anything else in life. And if you have that concept within your practice, to me, it's never been about selling dentistry. It's about enrolling people in their health so they can make good choices. And I say this a lot in my lectures. I want to be candid with kindness, right? So
Yeah.
I ask my patients that when they come in for a new patient exam, I said, I want permission to be candid with kindness.
And James, would you agree
Um,
that whether you're practicing, I'll call it slow dentistry, if you will, more deliberate than average, or you're in an environment where for whatever reason you don't have as much time as you might like, there's still enough time always for connection. Would you agree
oh,
with that?
absolutely. Or build it into your team. I coached an office from Florida a while back where, and I love this. He's my age. So he has his hygienist give injections. He preps. He has his expanded funny. Let me get this word going. I'm so excited. I got to get my word going. But he has the expanded function assistants. They come in, take impressions, develop the restorations that they have in office CAD CAM, and they
Right.
submit them. And all he does is prep, and that's it. And he loves his job and he loves connecting. He loves to lead. There's a lot of different styles that you can have to find your why. I like the delegated office. I see a lot of them. Just have to have your why to make sure you're happy when you go home at night. Not every day is happy for me. I bear the burden. I'm really sensitive to people. In fact, sometimes I wish I wasn't so sensitive like for instance, I give great injections. People, in fact, I had a dentist last weekend and I gave him a lower block. He goes, I didn't feel uh, anything in that. How did you do it? Well, you know why I want to give great injections? Because I'm so sensitive that I feel the anxiety in the patient
Yeah.
and I don't like it.
Yeah. Yeah.
I mean, I'll tell you this. I've been giving, in fact, I used to help teach giving injections at Loma Linda. I had a small educational career there before I went out into the world. And I was really good at what I did. But and in fact, I've asked people, and we'd like to ask the audience right now, I've asked people in my classes, how many get anxiety before you give a inferior alveolar nerve block? Almost
Everybody would raise their hand.
almost 70% of the hands go up.
Yeah.
Now, okay, now translate that into 40 years or 50. I mean, who wants to have that type of anxiety every day? Uh,
Absolutely.
I'm real. It's made me good at what I do, but I still have to deal with that sensitivity. I know I'm going a little here, but I think we can tie it back into
Oh,
connecting.
absolutely. Well,
People
by the same
still love a
token,
good injection. They love my injections. That's part of connecting because when I'm there, I'm feeling them. No, I'm on a roll here. Do you mind if I say a few more things?
absolutely.
Okay. Our connection field subconscious is 8 feet. This comes from my wife. She's a therapist. The connection field subconsciously of a horse is over 100 feet. So there's when I talk about connecting and communication, it's just not what I say or how I'm looking at you right now, Mike, because you don't look your age, and you and I could almost be brothers, but we would have been too close in our birth pattern. But what I'm saying on this is that part of connection is how people feel in your presence. Do I trust? Do I not trust? I'll tell you where I get a lot of trust is that first injection. And I treat a lot of dentists because I'm on a lecture circuit.
Yeah.
And my attitude is master your path so the things that get in your way no longer become a deterrent, but they become your strength.
James, I have to comment on what you just said about this because dentistry is so personal and
Oh, really?
so intimate. You know, the patients there, they are reclined.
Mm-hmm.
And unless you want to be reclined, when you're in recline and vulnerable with someone with sharp objects and rotating
Mm-hmm.
instruments, you don't want to be scared. And if you have taken the time to become good at something that can really hurt, you know, the injection, that in and of itself shows the caring that you have. And it
Yeah.
also, if you will, through your vibration as a competent clinician, that's coming across. Now, I underline this point for all of us together is doing great injections leads to more patients, leads to
It's
keeping,
huge.
right? And it's a
Huge.
simple thing, it's so simple yet beautiful that you pointed out. It's like master this, and you're going to be a step above many other clinicians where they don't take it nearly as seriously as they might. Would you agree?
They'll trust you. Like, do you
Yeah,
mind if I take this just a few steps further? Like, for
sure.
instance, when I'm working on someone, it's the first time I've ever been with them. Even before I put the chair back, I said, I'm going to lean the chair back here. Are we good with that? Are there any constrictions that you have? I'm
Right.
always looking for the comfort of their neck. Then, just as simple as this, like if since I'm older, right, I have to ergonomically look to optimize my existence or I'll cease to exist with this neck of mine. So, what I do is like, even when I turn the heads a lot. I'll even the way I touch people, I'll put my hands on their cheek and I said, I'm going to help your head move this direction, and you let me know if that's good for you. See, what does that tell you rather than just this way? Come on, oh no, up, neck further up. All these little things is about being considerate to people because if they have a little anxiety, here's how you know whether people are getting over anxiety. I always use blankets because I run a little hot, so I keep the temperature at 68. So I put everybody in a blanket. Very few people don't want it. So we're tucking them in, right? And then this is how I know they're comfortable. They fall asleep.
Yeah. Wow.
So why do they fall
That's called
asleep?
unconscious conscious sedation.
See, all these little things you pay attention to,
Yeah.
because if you want to be successful in dentistry, if you're successful at that subconscious level with people, they're going to trust you more. See, it's about trust. They'll do treatment and even discretionary treatment with people they trust.
Yeah.
So,
Absolutely. And like you said, it's true
mhm.
not only in dentistry, but in every other aspect of life. James, thank you for that. Let's go to a different part of reality. And you've underlined
Mhm.
really so well fundamentals for having peace of mind in how you are practicing dentistry, right? And certainly financially, what you've just underlined, your odds of success are much better, with these things in mind: clarity and improvement in education and consideration and connection. These are fundamentals that are prerequisites for financial success and stability.
Mhm.
So here we are in this world, and I know you talk to dentists and you talk to patients. What's different in the post-COVID world in dentistry? Have things changed, and are things more stressful or are they less stressful than they were before COVID?
That's a really good question. During COVID and coming through that right back in the office, there was a lot of uncertainties.
Yeah.
So I'm not going to go into the discussion of the virus. But having said that, I think it helped us to look more. I see it as a positive in this sense, where we became more in tune to what's important to patients to feel safe. So I'm going to leave it that there. Now,
Okay.
we do know that a lot of practices up until this year had a surge in treatment. First of all, people got behind in treatment, right? Number one. Number two, more money became available. Not
Right.
saying I like the way it became available, but it did. And a lot of practices surged. So having said that, I think the hardest part of what we see now is based on which statistics you're looking at is we had a large population of dental support retire from dentistry. So I see a big issue with staffing. In fact, I went to a meeting a year ago and the ADA president was there and he brought that up as a major concern within our profession. And I want to get to this in just a moment because if we don't have the staffing, if I'm not certain, even within medicine, you had a huge retirement. There was a huge retirement even in dental hygienists, and so we don't have that availability. And so dentists panic. In fact, I'm on several forums where dentists they don't know what to do because they can't hire staff, and the staff are coming in who don't have good skill sets, just asking for abundance of compensation. I believe in compensating my team very well, but it needs to be part of the program and performance. So having said that, there's another concept I'm going to introduce to you that
Uh-huh.
I think would be the fourth thing of the three questions you ask, and that's self-reliance.
Okay. So tell us more.
I've encouraged people for a while, but it's really become more prevalent now. From COVID, I have less two staff members now than I did. So my staff members have been with me for years. So I have a front office, I have a chair side, and I have a dental hygienist. And we have several hygienists that come in and help us. We used to have two more staff, and we're still producing as much as we did before. So how do you do that?
The-
Uh, what do you do if a team member is ill? Like my dental assistant is ill. Do we reschedule everything, or can we still produce? Which has happened this year. And self-reliance is developing techniques and workflows that the doctor knows how to clean a room and set a room up, right? You may have to reschedule a few things. Can you work by yourself within degree? Like if I'm working on a woman, I always have another presence somewhere. But my office was set up so if I have a woman I'm working on, I'm in an operatory where I'm in direct eyesight of my front office, right? And they're aware of that. So we have to be sensitive to the etiquette protocol of how we conduct ourselves with our patients so they always feel safe. But having said that, can you work by yourself and still be very proficient? I would suggest you can. Are you using a rubber dam or an isolite? Do you have your workflow down with your setup so you could prep a full quadrant by yourself, or do you need to have someone there to help you do that? I would suggest I can prep a quadrant as fast as if a system was there suctioning. But there's avenues that you can develop and skill sets you can develop to be very self-reliant. And that would be my suggestion to where we are in our profession right now, because I think our out problem since the pandemic has been support in the office. My recommendation is you may want to develop a few new concepts. And that brings me into other things such as digital dentistry helps me to be more proficient because I don't need an assistant to take an impression. I'm just going in with a camera to take an impression. I have all the digital components in my practice and lots of experience in it because I teach it. Do you print? Are you printing your temps versus making a analog temporary? Can you print them as fast? Are they more secure? Are they not going to come out so you don't have to have a schedule of saying so and so is coming in because their temp came off? You don't need to do that if you're planning your package well. So my big push now in my coaching, particularly in the clinical theater, which is what I call it, is self-reliance.
And I think that really not only is spot on for dentistry, but it's spot on for so many businesses today.
Yeah.
A lot
Yeah.
changed with COVID, and for again, good and in some ways maybe not so good. Let's go back to your point on self-reliance as it relates to people. One
Hmm.
of the things that revolutionized medicine was checklists.
Yeah.
And not only washing hands, but checklists, and the history of how all of that proceeded. The advent of flight,
Yeah.
checklists made a big difference. So I would think that what part of that is, not only are you going to cross train, but
Hmm.
and validate the cross training, but you certainly want, if somebody's not doing it every day, make sure that there are systems in place that and procedures in place and checklists, if you will, that are going to be followed that
Yep.
increase the certainty and confidence that, hey, I can step in and do this. May need to double check the checklist or follow the checklist. Does that make sense to you?
Everything should be identified in that order. For instance, I'm sure glad I fly twice a week. I'm on an airplane. I'm sure glad the pilots have a checklist, if you know
Yeah.
what I mean. Within my practice, there's a protocol order process. In fact, quite often in the morning, I'll meet with Jenny, who's my main chair side. She's been with me for 20 years. And she likes it because I probably work 45% or even 50% by myself. I mean, I can prep a full upper arch by myself if it's the right situation with a nice light. She can step in if we need additional support, but it allows her to be more proficient behind the scenes. So she utilizes her time extremely well. So do I. And so I think when I'm saying that is that we're very, very productive. I work 2.5 days a week. And
And
we do as much dentistry as a 4-day week for most offices. So I think part of that is just knowing your systems and then perfecting your systems. I'd say the number one reason I can do that is because I use digital dentistry and not analog.
well, let's go into that world now. Okay. And
Yep.
but before we get into CAD CAB dentistry, and there's a lot to talk about there, just spend a few moments on these two words, biofunctional and aesthetic. What does that mean to you?
Biofunctional to me is think of it this way. We swallow 20, probably about 2,000 times in 24 hours, right? So every time we swallow, unless you have a lateral tongue thrust or anterior tongue thrust, your teeth are coming together. So what is the balance of your occlusion and the posturing of your occlusion to what's going in the mouth? Today, in fact, in my practice, and even me at my age, is my patients and the type of practice I have, they're not losing a lot of teeth, but they're wearing them down. So
Yeah.
biofunction or functional dentistry is understanding that sequence so patients can make choices. Like, for instance, in my mouth, how am I doing this in my mid 60s? My second molars have a little wear. I'm starting to see a little bit of the dentin shine through on the occlusal surface, right?
Uh-huh.
Which means I have my immediate side shift is a little bit more mobile than it used to be, and I'm peeling out on those back molars, whereas my premolars have no wear and tear. Well, what does that tell me about my mouth? I get a CBCT of every patient I treat. I look at their skeletal system. I'm looking how their skeletal system has developed so we understand their envelope of function when they're opening and closing. A lot of people aren't ideal and they're going to do just fine not being ideal, but some people aren't. So that conversation is really important with our patients. So biofunctional to me, particularly when I get into aesthetics, often is recovering smiles that maybe someone never had or they're worn out. So if we're looking at a biofunctional platform, we need to understand how they got to where they're at, when choices are made for that treatment and application, it's going to be in their best interest because we all know function becomes before beauty, right? You can make something really beautiful. And if you don't have the functionality or if they have traumatic episodes within their chewing, swallowing system and all that,
Yeah.
then it's going to destroy what we put in the mouth. So that's what I mean by biofunctional dentistry.
Okay.
I'm so excited. I had a hard time getting that one out.
You got it. But let me just then continue on with that.
Yeah.
Whether I could be a dentist right out of dental school. I could be a dentist in my mid 40s. And here I am, and I'm listening to this interview. If I want to go, okay, I really want to learn more about what James Klim just talked about. What path would you put them on for knowledge?
Very good. First of all, find your why. But if a lot of doctors that I teach, they want that larger comprehensive understanding of patients so they can talk to them in a certain way. Some of my favorite educators and mentors in life, John Coyce, Frank Spears, the Pankey Institute, you name it. The doctors that go through those institutes and learn the complete side of dentistry excel because they look at dentistry differently. And when you look at dentistry differently, you find out what you didn't know.
Are you
So you,
saying that those postgraduate centers of excellence, of knowledge and excellence that are always adding to the body of knowledge, that they give you a more holistic understanding
Mhm.
of what the mission is in analyzing and diagnosing that human being, not just the mouth, right?
Mhm.
But being
Mhm.
able to look at what is there as a whole. Is that what we're talking about?
Imperative. It's
Okay.
actually imperative. We look at as dentists, we look at the mouth through what we understand the mouth to be. I know when I got out of dental school, just to be frank about it, was, I graduated top of my class. I had my academics. I thought I knew it all, but I didn't. But it was a good place to be.
Right.
And then you get into practice, and that's and I'll. It doesn't mean you can't be good at doing a crown or a composite or a restoration here and there. That's fine because I find that young people, and I train a lot of them right out of dental school, they're really, really, really gifted. They haven't been exposed to the bigger picture yet. As our understanding becomes more full, then we see life differently in the dental field, and then we communicate differently. The confidence factor is real important, and I've seen this before. And in fact, if you look at the basic behavioral types of dentists, the majority of dentists are people pleasers. A lot of the dentists that go into dentistry are in that realm. So if they have a hiccup or something goes wrong, they have a tendency to either, most of them, I would say, have a tendency to pull back and get really cautious. Now, the younger groups today are a little different, and I'm still learning to understand that. But I'm talking about my generation. By gaining confidence through knowledge, it gives us confidence to do workflows that we feel really comfortable with. Like, for instance, implants and placing implants. Everything in my office is crown down. I design it first. Everything is done through a guide or robotics. And that's where implants are really going now because we can project a better outcome. Still need your surgical skills, but by understanding the process through a digital platform. So, for instance, I know where my platform on my implant's going to go based on how I'm going to restore the final restoration and how much depth do I want for that implant emergence. Do I want a switch platform? Do I want it subosseous so I can optimize my biotype? Those are the things that once you have those understandings, then it raises you to a new level of confidence. And doesn't mean that things work all the time, but the batting score definitely gets better.
So an additional follow-up to what you just said is whether you are young or older in dentistry, if you want to practice more confident dentistry, have more peace of mind in dentistry, and perhaps even have greater case acceptance when you diagnose and present, gaining this additional level of understanding, which is not a weekend course, it's going to take some time, but
The
it's not
journey.
by the same token, it's not going to take you 5 years per se, right?
Hmm.
Within a year or two, you're going to know so much more, but it's time well spent and it's money well spent. And whether one likes it or not, just because you got through dental school and passed your boards isn't enough, right?
Is you ready to start?
Okay. I love that. So now let's just move on to this next word, which is aesthetic. Okay, why is that right up there with for you with biofunctional?
A lot of the biofunctional problems that I see, which would be accelerated wear and tear, or maybe they had airway problems as a younger person and their jaws didn't fully develop, which leads you more into parafunctional activity. These are the people that I treat. And so the niche of my practice is off of function because I treat a lot of Team D clients. And Team D clients are interesting because the cause of Team D is all over the place. And we have to understand that a lot of clients that come to me either come for Team D, but probably the majority come for beauty. But then we discover these other aspects of how their body is functioning. If we address it in the right way, we can lead them to a better, secure outcome. I have clients to this very day that I did full mouth rehabs with Impress. And we're 25 years later on two clients that, in fact, I present this in my lecture, and they're still functioning well. They haven't destroyed the Impress, which we know is inferior in strength to what we have today.
Yeah. Well,
So,
you're looking at an Empress aesthetic smile on this guy right here.
yeah, so we know it works,
Right.
but we can't control that patient in the office. In fact, patients always say, "How long is this going to last?" And I said, "If you stay in my office 24 hours a day and let me manage you while you eat," I said, "we're probably going to be good for life." But I said, once you leave here, I don't have control over that behavior. So what I need to do is inform you what your behavior is going to be that's going to accelerate the wear and tear and aging of your mouth. And
Okay.
there will be a time in your life where you may have to upgrade these based on how you age.
Okay.
You may want to put that recording several times because it's you patients have to own their treatment.
So there was this expression that I had for a long time, fit, function, and aesthetics
Hmm.
from a lab perspective.
Well,
Got to fit, has
definitely
to
on the
function
fit
properly.
side,
Yeah.
yeah.
But kind of fundamentals that you want when you're training people, to remember those things. That was something my dear father, who, he passed the torch to me in dental lab
Yeah,
technology. God rest his soul. Uh,
yeah.
so and these things, certain things we know they stand the test of time. Our
Hmm.
Dr. Art Kroll, the eye bar. He told me as a young dental technician, Michael, the test of truth in dentistry is time.
Yeah.
He was 21. I had no idea what he was talking about. Doctor, should I tell you the time? No, he was referring to exactly what you and I know, which is not everything that's brought into dentistry works. That's true in medicine as well. So we have to just accept that reality that this is the nature of human progress. We try things and sometimes they work, sometimes they don't. What we
Hmm.
certainly want in dentistry are to do things that we know will last. What I'm interpreting when you talk about biofunctional and aesthetic is it's like the scales of justice. They go together,
Yeah, that's a
right?
good point. I'm going to plagiarize what you just said.
Well, because you can't have one without the other,
No,
right?
you
If
can't.
you're doing aesthetics without understanding biofunction, you're going to create problems that weren't there.
Yeah.
And if you're doing biofunction and not really recognizing that the patient does want a better smile, typically, if they value that. So we want to balance that. So well said. Thank you.
But Mike, I want to just get one more point
Sure.
on this because you said something that I thought was real important. And this is how I explain when I'm educating and to my patients. The majority of my patients, I would say over time, do not have ideal biofunctional mouths, but many of them exist with it, and it's good enough to get through life.
Right.
What happens is if people have premature aging, and that's what I call it, due to maybe host environments, genetics, maybe not having good airways is children. When the airways aren't there, you'll see a exasperation of functional wear and tear. When we recognize that, we have to understand that there's more risk to anything you put in the mouth because that pattern often will not change. I'm not God, nor will I ever be. And I think there's a sense in dentistry to teach this concept of where if I do it right, it's going to last. Well, there's a point of that that's true, but I can tell you, I've worked on patients long enough to see the same effort not get the same results. I remember a lady that I rebuilt a number of years ago and she did really well and loved it. And then she ran into a health issue, and her biology changed, which changed her acidity. And I saw her roots just melt away. And within 5 years after that, she was in full plates. So there's a lot of things in dentistry that can happen that are out of your control, but you want to control the responsibility of how people are investing in your practice so they're aware of the aging that they could have. I don't use the word risk factors. I use the word aging factors. It's a solemn word, but I'm more familiar with that. In fact, I'm here recovering from a hip replacement, and that was due to my aging. I can tell you, I am like a new man now. I can go out and walk. My dogs love it. I'm still recovering, but I was willing to go through that because I wanted to have a better quality of life.
Yeah.
The mouth is no different.
And when you have a situation like you did with your hip, it was debilitating.
Big
And
time.
and there are and there are patients where there's debilitation,
Yeah.
whether they realize it or not. And to have the ability to restore severe situations and to do
Hmm.
it confidently, uh, what a wonderful thing to experience as a clinician, to be able to handle complex restorative dentistry. And it
Hmm.
doesn't mean you have to be a prosthodontist to do that. With all due respect
No,
to them,
no.
the average general dentist can become competent enough where they can address complex restorative dentistry. Granted, there are certain cases where you say, no, this is beyond me. James, I'm going to say right now that here's what we're going to do.
Let's do it.
What we're going to do is we're going to have a part two.
Okay.
And in part two, we're going to get into digital platforms and dental materials,
Mhm.
because this is an area where you've got this tremendous clinical knowledge and expertise, and you certainly have the human side of it, extremely well developed. And there's so much for dentists to learn just from what we just went over in this last hour.
Mhm.
But you've got this tremendous expertise on materials. You are on the leading edge. Some would say the bleeding edge of dental
Sometimes it
technology.
feels like it's bleeding.
Yes. So here you are, and it's like, going to the top of the mountain, and
Yeah,
here you are, you're scaling it literally every day. Let's get together again. Okay, and part two of our time together is we're going to roll our sleeves up, and
hmm
let's talk about technology and digital dentistry, and should you be doing what a James Klim has been doing with making crowns and 3D printing, and why should a clinician be looking at 3D printing, and what's right for them, and what's the importance of staff and all that. And not everybody has the player coach capabilities you do. You are both a clinician and a superb dental technician. Not everybody has that ability or really wants to do that. So let's spend time on that. Does that sound like a good idea to you?
Mike, you and I share same passion. Anytime, I'll be there for you.
All right. Well, I look forward to our next session together, and I think that'll really round it out, right?
Love it.
It'll be the bookends
You
to
got it.
this world of Dr. James Clement and all that you do. Before we say goodbye and we go to this next episode, I'm going to do a screen share here. I just
Mhm.
want to, before we go to this next episode, I do want to share um, the website for your organization. So let me do that now, okay?
Mhm.
And we're going to take a quick look. This is it, right? Klim Institute. And I encourage those of you with us, before you move on to the next uh, session with Dr. Klim, spend time here. You offer both online training, James, as well as in-person courses. Is that correct?
That's correct.
All right. And my God, what a wealth of knowledge here. I'm going to scroll down here. You're even giving, some stuff away to give people a sense for what's there. You've got new content that you're posting frequently. This is the
hmm
how-to of it, right? And
hmm
I will tell you this. I think whether a dentist is going to have an Ivoclar programmat or a CEREC system, to look at how to get maximum aesthetics to achieve great results. If I'm not doing this in my office, what I'm going to be doing, if I'm a clinician, I'm going to be saying to my technician, who hopefully I have respect for, hey, let's look at this together. Let's look at what Dr. Klim has to say about how to characterize that zirconia restoration. Would you think, yeah, that's a good idea, that general dentists should be doing that, even if they're not doing their own restorations?
Again, even though I've done in-office CAD CAM, I think the greatest surge in dental dentistry will still be using digital platforms with a digital lab service. I really think that's the future. You'll have to make a decision: is where's the final fabrication going to happen? Some of it will be in your office, some of it will be with your lab. Then we have digital design surfaces. I think
Yeah,
that's going to surge more in dentistry. Even though I do in-office digital CAD CAM dentistry, I don't recommend that for everyone. In fact, could I just mention one more thing, Mike?
please.
Is that I know I've called you both Mike and Michael on this show, but you're the same person,
You
right?
can call
Uh,
me anything except late for dinner.
I would also suggest I have a lot of free content on my YouTube channel, James Klim DDS.
Okay.
And where I'm taking that channel is more into the full digital platform. I started with the Circ software. I love the exocad software. I'm also working with 3Shape. My future objective of education is to help provide information so when doctors choose that digital highway, they can find out what they want to do in the office, particularly with the digital camera. So as they choose their networking with either design surfaces or digital labs, they can make a more complete circle that's more predictable. And that's what I lecture on quite a bit I used to be throughout the world, but I haven't been traveling as much lately. I'm up here at my digital ranch and I like to stay here. Well, I'm at a ranch, but I have my digital theater on my ranch. So I think the future of dentistry is will be semi-office, but there's definitely be a connection of the digital highway within our profession.
Well, well said on that note, James. Really, what we have to look forward to in this next time together is our audience. They're going to be, they get this great insight into, hey, I want to take a closer look at that. I may want to do that in my office, or no, I don't know if I want to do that, but it's really
Right?
good to know. And this is something where I can point my lab to take a closer look. To me,
Absolutely.
that's really exciting because what we're talking about is a win-win for everybody involved in dentistry
Absolutely.
today.
And, and I've always told laboratories, your heyday is in front of you.
All right. James, thank you so much. Ladies and gentlemen, thank you so much for being with us on this episode of Dental Insight with Dr. James Klim. Get ready for episode 2. Bring your notebook. There's going to be a lot to learn and to take advantage of. Thank you so much. I'm Mike Kulwiec, your host. Dr. James Klim, thank you. And we're going to see you again very soon. Till